Sore tongue, what is causing it? Should I get worried with sore on tongue? If you have a sore on tongue, it is very easy to overlook it in most cases. However, you may find it annoying while eating or speaking, then begin to think if anything could be wrong. Be informed that sore tongue is not a major cause for alarm. Main causes of sore tongue and why you may need to see a doctor if you happen to get one. Accidental tongue bite may cause sore on tongue. Biting your tongue accidentally could be a terribly painful experience that will most likely leave you with sore on tongue. Likewise, stumbling your mouth on some extremely hot food could also lead to tongue burns or blister, to say the least. Clenching or grinding one's teeth could also make the edges on the outside of the tongue painful. Compared to hitting your leg or arm, the shocking pain won't just disappear soon after. Similarly, injuring one's tongue could result in a sore tongue that may last a number of days until the injury is completely healed. Soreness on tongue. You could also get big papillae that would cause you to have sore on tongue. The reddish or whitish bumps are commonly called transient lingual papillitis or simply as lie bumps. They result in sore tongue since your taste buds get swollen and are really painful. Normally the sore on tongue will simply clear off in a number of days without treatment. Yeast infection can also cause sore tongue, especially in infants and young children. The cottage cheese-like white patches on your child's tongue could be highly painful and uncomfortable. Oral thrush is very common in infants and adults of advanced age whose immunity is relatively weak. You are likely to have sore on tongue, oral thrush, if you've been on antibiotics in the recent past. People who are using inhaler steroids for asthma management can also develop sore tongue. Familiar infections that may result in you getting sore on tongue include oral, foot and hand diseases, papillomavirus for humans, venereal infection, syphilis. Ulcers of the mouth. Pain on your tongue could be centered on a given area of the tongue. Looking at your tongue through a mirror, you will likely see a sore on tongue oval in shape in a specific place. The sore tongue could be gray, yellow, red or even red. The sore on tongue can occur because of damages to the tongue or tongue bites. Chewing sharp or hard stuff. Anxiety or stress. Eating specific diets only. Quitting cigarette smoking. Hormonal imbalance effects. Ulcers of the mouth, also known as sore on tongue, will mostly heal within a week or two without using any medication. You can also consider OTC, over-the-counter, medications to manage discomfort. Avoid spicy or sugary foods as they are likely to irritate the sore tongue more. Allergy and sensitivity to certain foods. Certain kinds of foods could result in sore tongue due to you having OAS, oral allergy syndrome, also known as syndrome for the pollen food, usually caused by eating specific nuts, vegetables and raw fruits. Accompanying sore on tongue are mouth itches, throat feeling scratchy, inflamed tongue, mouth and lips. OAS, oral allergy syndrome, occasionally affect pre-teen children, teenagers and middle-aged adults. Your physician could request you have an epinephrine auto-injector if you are having acute reaction. Substance smoking. Substance abuse, i.e. quitting or indulging smoking addiction, could result in sore tongue. Smoking endangers your life as you risk contracting cancer of the throat or mouth. Other diseases that could develop as a result of smoking indulgence: colored teeth, smelly breath, loss of teeth or general decay, growth of yeast and hairs on the tongue due to bacteria thriving, gums having brown spots, mouth roof palate appear white, pale and thickened. If you choose to quit smoking now, you will reduce risk of contracting throat or mouth cancer in the next 5 years by half, says U.S. General Surgeon for CDCP, Centers of Disease Control and Prevention, in his report released in 2010. Little-known causes of sore on tongue. If you seem not to understand what is happening with your tongue, you could talk to your physician and be informed about the little-known causes of sore tongue that could be extremely painful. Because of so many health challenges in today's world, your sore on tongue could be a pointer to different thing. Lack of vitamin and anemia. If your body is lacking folate, iron or vitamin B12, you are likely to suffer sore tongue. Deficiency of vitamin B12 may also result in beef red coloring of the tongue, and low zinc levels may cause tongue burning. Additional sore tongue symptoms that are linked to vitamin deficiency are weariness, lightheadedness, unbalanced heartbeats, extreme weight loss, weak muscles, Feet and hands tingling or numbness. Lack of enough vitamins occur over a period, e.g. from a number of months to many years. Solution could involve eating foods containing all dietary plans, food supplements and getting injections for vitamins. BMS. BMS, burning mouth syndrome, is a feeling of burning sensation usually on the sore tongue, or other parts of the mouth such as on the inner cheeks, palate, lips or gums. It is a feeling that can be associated with eating exceedingly hot food that resulted in your tongue getting scalded. BMS can be a sudden feeling or can occur over a period. Additional BMS sore on tongue signs can include tastelessness, changes in known taste, drying mouth and uncontrolled thirst. Severe pain on tongue nerves, neuralgia. Sore on tongue usually results in neuralgia, in the sense that nerves around the affected area of the tongue experience terrible biting pain. In other cases you could simply just feel recurrent pain for no apparent reason such as infection or sore tongue. Neuralgia is a very intense pain that can only be likened to shock by electricity. The pain can be felt from your ears, throat or in your tongue. It could be caused by swallowing and can happen to people with neck or throat cancer. But the cause is unknown. In case you are experiencing this condition, please get medicines to help you deal with pain of the nerve or talk to your doctor about surgery. Chronic skin condition known as lichen planus. Lichen planus is a skin condition that may make you get sore on tongue, patches with white laces on your skin, and rashes that itch. Minor cases of lichen planus cannot be felt at all. Additional symptoms of sore tongue caused by lichen planus are whitish or reddish mouth patches, burning sensation while drinking or eating. Also your gums could turn red and very painful. Ongoing treatment could be necessary. Behçet syndrome. Behçet syndrome is a disease that make a person's body veins to irritate all over the body. Although it rarely causes pain of the tongue, it can make you get sore tongue that is similar to cankers. The sore on tongue start appearing round and raised and could remain for up to 3 weeks and could recur with time. Related symptoms of Behçet syndrome, skin lumps and sores similar to acne. Irritation of the eyes. Painful joints. Difficult digestion. Ulcers of the genitalia. Molar Hunter glossitis. Also referred to as Hunter glossitis, smooth or bald tongue is a kind of tongue inflammation that causes sensational burning of the tongue, irritation and pain. Molar Hunter glossitis causes your tongue to appear glossy and extremely smooth as a result of depopulation of papillae, then your tongue becomes tender and painful. The condition is associated to lack of nutrients such as vitamin B12, celiac disease or anemia. Use of certain medication. Nonsteroidal medications such as Aleve, naproxen, or beta blockers indicated for managing inflammation have been established to cause sore tongue and ulcers of the tongue. Certain mouthwash could also inflame sore on tongue. Autoimmune disorder, pemphigus vulgaris. Pemphigus vulgaris is an autoimmune challenge that is likely to cause you to get sore tongue as well as genital sores. In the mouth, the sore on tongue could resemble blisters which could bust and produce pus, then get infected, rendering swallowing and eating almost impossible. The condition can be treated using a number of therapies and medicines similar to the ones prescribed for acute burns. Cancer of the mouth. Cancer of the mouth is also considered to cause pain in an individual's tongue. Although cancer of the mouth is seen as a reason for sore tongue, it is a very rare reason indeed. In any case you realize a painful lump or sore on tongue that persists for long, it would be better if you seek doctor's advice and checkup. Related sore tongue symptoms may include pain while chewing, pain while swallowing, loosely attached teeth, sore tongue that refuse to heal, bleeding sore on tongue, mouth lining, skin thickening. Cancer of the mouth usually don't cause pain at the beginning, therefore, it will be good if you locate your physician if you notice that the lump hasn't disappeared within 2 weeks. Autoimmune disorder, Sjogren syndrome. This is a very rare autoimmunity disorder leading to lacrimal and salivary glands inflammation, which in turn may cause you to have dry mouth and dry eyes. The disorder is also linked to other health issues such as painful joints and changes in the skin. It's not known why other people suffer from Sjogren syndrome. For people who have critical dry mouth, their tongues usually get fissured and very dry, making it easy to develop sore on tongue and infections. Decision to visit a doctor. Immediately reach your dentist or doctor if you are concerned about the unusual changes in your tongue such as sore tongue, lumps, color change and pain lasting more than 2 weeks. Although pain on tongue is usually not a major cause of worry, reaching your dentist or doctor could help you eliminate tongue uneasiness causes such as cancer of the mouth or pemphigus vulgaris. Your dentist or doctor may also indicate medicines to treat sore on tongue, infections and other related health issues to make you feel okay.